Hello and welcome to LA Currents. I'm Anita Bennett. Health officials here in Los Angeles are urging those eligible to get the updated Omicron Booster shot. Now, those shots are available in more than 1,500 locations across the county. And one of those sites is Kedren Community Health Center in South Los Angeles. Joining us to discuss this is Dr. Jerry Abraham. You are the Director of Vaccines at Kedren.
Absolutely. Thank you for having me, Anita.
Thank you for being here. So what is happening at Kedren? Are a lot of people coming out to get this booster shot?
Yeah, absolutely. I'll just start with saying thank you so much again for having me, Anita. You have covered this pandemic through testing. Then when the vaccines came out, we really appreciate covering the story with a lens on health equity and racial justice. And that is what we've been doing at Kedren, is making sure that Black and brown populations that are often hard to reach, hardly reached, have access to COVID-19 resources. And that's still what we're doing today. We have vaccinated nearly 400,000 people and tested hundreds of thousands of folks. We've also now provided therapeutics. You might have heard of Paxlovid, some other interventions. We do a lot of community engagement and patient education, along with really making sure that our communities are pandemic ready, including dealing with the realities that people are still living with COVID.
When the pandemic first started and the vaccine first came out, I remember visiting Kedren, and there were people coming from all over, Orange County, other countries. How do you make sure that the local folks get the vaccines that they need?
Absolutely. If you remember those honestly kind of dark days, it felt like a boarding gate at LAX where there were zones, priority 1, 2, 3. We wanted grandma and grandma to walk right through. Those who had mobility issues or couldn't see, couldn't talk, couldn't walk, those folks came right through as well. We also made sure that we piloted those from the zip codes hardest hit. For example, in South Central and South L.A., we're able to walk right in and get their shots. And so that's really how we made sure we prioritized those with the greatest need come first. And that's really what health equity and also righting the wrongs of racism in the past as we address racial justice is to make sure that especially those that are left behind get their first shake. And that's what we reminded our communities in South L.A. Black and brown populations, you should be first in line to get these treatments. They are for everyone. But we know that education was an important part of it too. We wanted to make sure that people didn't feel experimented upon, that this wasn't some sort of weird microchipping 5G technology.
And we're going to get to that, some of the concerns and the conspiracy theories. But when you mentioned like pulling people through, what were you going through the line? What were you doing?
Absolutely. Yeah. I mean, it was a field hospital for sure. It reminded me of an episode of MASH. I mean, we had people from all around the world that came to serve and volunteer. Not did people just showed up just to get their shot. People showed up, rolled up both their sleeves and said, I'm here to volunteer. We had resources pouring in from the United Nations, the World Health Organization, tents from UNICEF, teams that would go and deploy in various parts of the world. They came, and with those strategies, people that knew how to handle this kind of volume, we were able to vaccinate 2,000 to 5,000 a day. Imagine Dodgers was vaccinating 10,000. This little hospital in South L.A. was able to do 2,000 to 5,000 a day, and that's really because all of these resources, partners came together, and we were able to walk down the lines, and we did. The LA Times broke the story saying that, oh, look at Kedren, they're letting white people get vaccinated. And what they didn't tell the story was because we're prioritizing our community, yes, Black and brown people were not waiting in line. So you did see people from other zip codes, Malibu, Beverly Hills, Orange County, camping out for days, Uber Eatsing, remote working, the things that our people didn't have the luxury to do. Yeah, that's what they saw. But what they failed to tell the story was that we made sure the communities hardest hit came right on in, got their vaccines, and ultimately it saved millions of people's lives, to be honest.
Wow. Well, we told those stories here. So I just want you to be aware
Thank you
of
for having
that.
me. I remember the day that we were here, and we were here with you and with Councilman Curran Price. We needed to tell the story because often these stories are hiding in the shadows and they're easily forgotten. But if we let these stories disappear again, I have a feeling the atrocities of COVID-19, where Black men are 3 times more likely to die and where Latino men died at much higher rates than the general population, That's what's at stake again. And we don't want to forget these lessons, and we need to remember them, and we need to implement them moving forward in a sustainable fashion so that our communities don't continue to get the short end of the stick and get left behind.
Mm-hmm. And you mentioned some of the conspiracy theories. I mean, I've heard it all. Like you said, there's chips in the vaccine. How do you dispel those myths?
Part of it is understanding that some people need to hear it multiple times. For some, it may be 1 or 2 times. For others, they really need to feel comfortable. It might take up to 15 times. My team is out there every day with street medicine and mobile medicine. We have been threatened. We've been told to leave our community. Don't you bring those vaccines to our community. We're in gang territory as well, right? So there's a lot of those kind of safety concerns and risks. Some of those individuals over time have changed their hearts. They've softened their stance. In fact, some of those folks have actually gotten vaccinated. It's because we built trust. They knew we weren't here just to tell you to roll up your sleeves, trust us, take this medicine, never see us again. That's not what health and being healthy is all about. We need to be ever present. We need to be an institution that can be trusted. And that trust really was missing, which is why it was so hard in the beginning to really get Black and brown individuals to come out. And really briefly, I've talked about this before, the medicalization of racism. So when we talk about the Tuskegee trials, where Black men were denied treatment of syphilis, Latinas were denied good care here at L.A. County, where they were sterilized against their risk. Black individuals are not treated for pain equally or appropriately in our hospitals. These are real, these are lived experiences. I think of Henrietta Lacks, her DNA abuse, her family not getting credit. So when you ask people, why are they not coming? I don't think that's a fair question. You're putting the burden on them. I think we have to say, acknowledge this and say, we totally get why. We have a much longer journey that we need to cross together for you to trust us in order to take our recommendations seriously.
Does it make a difference to have doctors who look like people in the community?
There is no doubt. That makes such a big difference. One of the things that our team talks about regularly is how traumatic the interacting with the healthcare space can be for patients, especially those that have been left out. That waiting room, interacting with the front office, going to a sterile, cold exam room, being met with a doctor who doesn't understand you, may not speak like you, doesn't know your story, and you don't know if they're really there to help you or not, or just move along to the next patient. All of those are the realities facing our patients. And so by us democratizing, ubiquitizing health and going outside of the 4 walls of clinics and hospitals, we're really able to meet people where they are. And that's what our program has done. Once we got through the eager beavers that had all come to the vaccine centers, we really focused on taking the vaccines to where people live, work, worship, play, where they go to school, and making sure that we reach the homebound. Just remember, there are lots of folks that can't even leave their home for various reasons. And we deal with the realities of no child care, elder care,
no car,
lack of transportation. This is how you leave people behind. And so unless we address those social determinants, if you don't really provide wraparound services and treat people like people with dignity, respect, and provide them wraparound services, you're going to leave people behind. But by us going to churches, houses of worship, workplaces, the schools, housing developments, we've been able to really move the dial on achieving health equity in our community by meeting people where they are. And that builds so much trust. The number of times people have come up to and said, Dr. Abraham, I've seen you on TV. Number 2, the fact they would send you to our community. I know I got to take this seriously, and I'm going to take those vaccines and those recommendations you make very seriously.
So you and your team went to churches?
Absolutely.
You took the vaccine?
Absolutely. Oh, it was like an altar call. Oh, yes. The minister would ask us to come up and speak, and then we would say, these vaccines are for you. They're not just for rich people or white people. People needed to hear that. They needed to know that. They needed to see their pastors, their leaders, their teachers, their coaches, their respected elders getting vaccinated in front of them, and that built trust. And we'd literally be in the back of the congregation, and as people are ushering out of services, they were rolling up their sleeves and getting their shots. People go to church and they get healing, for their soul. We wanted to also provide healing for their bodies. There's a beautiful space that we can be at in sacred spaces like churches, but also in educational spaces like schools. People go to work. Why not meet them where they are going and they're bending over backwards to put food on their own tables and keep a roof over their head? Let's make it easy for them. Let's come to them and help them there. It's not brain surgery. It's not rocket science. I don't know why it's taken so long for us to get here.
Absolutely. Did you work at all with the councilman's office?
Absolutely. Yeah, this has been nothing short of a labor of love, and all of us having to come together with the city and the county and the state and at times the feds. And that's what scares us now. As President Biden, I truly believe, carelessly or recklessly said the pandemic is over, that has real implications for whether or not people in our community are choosing to get these Omicron bivalent boosters. And that's damaging and hurtful. And we're very concerned with federal resources coming out of COVID. Will my people have access to tests, to therapeutics, to vaccines? That's scary. So the commitment we're making from Governor Gavin Newsom's office on down, from the California Department of Public Health assuring us, don't worry, we will make sure you have those resources, especially for Black and brown communities right here in South and East and Southeast LA, are really critical messages. And we're hearing that from our local county supervisors and the Department of Public Health right here in Los Angeles, and from Mayor Garcetti and from Councilman Price, Marquise Harris Dawson, and multiple others that have stepped up to make sure that our people continue to get the resources and the care that they need and deserve. Our people deserve to live just as much as everyone else. And our goal, as I always say, best life, longest life, healthiest life, happiest life. That's for everyone, regardless of your socioeconomic status or what race or ethnicity you are.
So you say the city and the county have definitely continued to help, but at the federal level, has the help continued? Has it slowed down? What's happening with that?
There's no doubt that at the federal level, the resources are starting to slow down, and that is due to a lack of action on Congress's part. We need more leadership from the White House on this. I think that, with reshuffling and reorganization at the CDC, things are getting lost in the shuffle. The Food and Drug Administration has a lot to do in terms of approving all sorts of therapeutics for cancer and everything else. COVID's getting lost in the mix. And that was exactly the warning that we had provided people, was if we don't remind ourselves what's at stake and who we lost, it's just going to go back to the way things were. And I feel like that's what you're seeing. Testing is not easy to get anymore. My patients don't have the luxury of paying $50 for a test at a retail pharmacy. Half the neighborhoods we serve don't have retail pharmacies.
It's even more. I know I had to get one of those rapid tests because I had been exposed. I think it was like $200.
You can imagine if you need that to go to work. If you're an undocumented migrant worker in our community, you do not have the luxury of spending $50 to $200 for a test, and yet your employer might say you got to have a negative test to come back, or you may need this to do X, Y, or Z, including travel. Those are all very scary places that our patients are really grappling with. I don't want anyone to be worried about, should I buy food or should I buy a COVID test? That's silly and that's nonsense, and we need to make sure we guarantee that some level of COVID resources continue. We're going to have a wave in the fall. We're going to have a wave in the winter, and if we lose all of this, it's dangerous.
So even, with Biden saying COVID's pretty much done, you definitely think there's going to be a surge?
Absolutely. I mean, we can predict that the flu, when we look at what's happened in different parts of the world this year, the flu numbers are going up. We're taking off our masks. We're feeling more comfortable. We're gathering again. That's exactly how infectious diseases, communicable, contagious diseases spread. So we anticipate that the flu season is going to be harder than usual. People may not be getting the flu shot. I think a lot of people have not been getting health services, and we've learned some bad habits throughout the pandemic by isolating and not taking care of ourselves. Routine health maintenance, those things are not happening. So we need to go out, get our flu shots, and most importantly right now, we need to go out and get those bivalent Omicron boosters. Honestly, everyone's eligible now, 2 months after your last shot. 12 and older for Pfizer, 18 and older for Moderna. We need that protection. If we have that coverage, we won't see the hospitalizations and the deaths that we anticipate. And I'll just remind everyone again, we don't ask you to do it just for you. We do it because there are aging and ailing individuals whose lives are at stake, and there's no reason to jeopardize those people. We want to see them this Thanksgiving, this Christmas. Why would you ever jeopardize grandma's health or maybe your cousin who has cancer? That's who we're saving by all of us getting vaccinated.
What about small children? Any idea when they will be eligible?
Yep. So right now we are providing vaccines for people 6 months and older. We're still rolling out.
But I mean the
boosters,
the booster.
But right now we really want to make sure that the 6 months and over are getting their first and second shots. And the data shows only a third of eligible children have gotten it. People are still very worried that this is, too new. They're worried, does this affect development or puberty, reproduction? Will my daughter be able to get pregnant if she gets vaccinated at 10? These are real concerns that people have. So we're really trying to make sure that we assure people, and I remind people, these are not experiments. Vaccines have been around for a long time, including smallpox vaccines that we've been using since George Washington's day. And we don't see polio in our society, and that's because of vaccines. You think about chickenpox, and you think about all the things, measles, mumps, rubella. Some of these things are making a comeback. You saw polio in New York recently, or measles at Disneyland.
What about monkeypox?
Right, so that was another one that I feel like has kind of disappeared into the shadows. And this really reminds us sometimes of the HIV/AIDS epidemic that was stigmatized as a gay disease. So we saw this monkeypox case, which traditionally happens in West and Central Africa. Somehow it traveled to Europe, then over to the US, and then we had this surge of cases. Thankfully, because of rolling out the monkeypox vaccine and people changing behaviors, we're now starting to see a leveling off and a decline, but we still see increasing numbers in Black and Latino, particularly men who have sex with men. So we want to make sure those that are eligible are getting their monkeypox vaccine. And that's a lot of what we're focusing on as well. So even though you don't hear about it or you don't see it, just remember there's so much happening in the background, and there are people that are suffering from real illnesses, including monkeypox. And we kind of have to do all of it. That's the truth. Walk and chew gum at the same time.
If someone thinks they might have monkeypox or they might be exposed, how do they get vaccinated?
Yeah, absolutely. So you go to the search monkeypox Los Angeles, you'll end up at the County Department of Public Health. Many sites, including Kedren, are offering the monkeypox vaccine. We also have treatment that we're using for monkeypox called TPOXX, tecovirimat. That's been shown to be effective at reducing the symptoms and ending the illness sooner. We know this is skin to skin. It can also be sexually transmitted. We've noticed it happens in certain networks where more of that may be happening. And so some of the curbing of behaviors has helped, including we've been going to commercial sex venues, bathhouses, and the other, making sure that patrons of those institutions are getting vaccinated, understand the risk and how things are transmitted. Half the time it's because people didn't even know that it's around or how or why they're vulnerable or susceptible.
So we have to do a better job of informing people. But when you go to these places, are folks receptive?
Yeah, I mean, I definitely feel that what we, not shocked by, but we're always thankful and reminded about is how many people are not able to access the system in the traditional ways, including going to the doctor's office or going to your regular pharmacy. That's just not the reality of many individuals. Many people may never see the doctor until they truly are very sick or something. So by us meeting people where they are, we talk about when we go to commercial sex venues, there are people with real sex addiction. We talk about people that have transactional sex for housing, for food. These are not people that are lightly making these decisions. There are people that are in interpersonal relationships, domestic violence, where they may not have complete control over who they may be able to have sex with. So you see how and why there are different communities where the stakes are higher, the risks are higher, and the best way to reach them is to go where they are, including in the homelessness encampments, the shelters.
That was my next question. How do you reach the unhoused?
Can I just say, I feel like we're on the same wavelength. I'm always like a step ahead of you, so I'll slow my roll. But yes, to that point, we really do our best to get to those shelters. We've been working our way throughout Skid Row, along with several brother and sister clinics, including JWCH Wesley, LA Christian, St. John's. Many of us have come together, including APLA, the LGBT Center. We saw there's several groups, Men's Health Foundation. We've all been working very hard to make sure that the monkeypox vaccine gets rolled out equitably, and that we definitely make sure Black and brown men are specifically reached and prioritized.
You mentioned reaching men, are you seeing any women in need of the monkeypox vaccine?
There are. It's a very small percentage. But if you believe that you're at risk, and we kind of go through a questionnaire, and based on those answers, if you were at a venue where there might have been a lot of skin-to-skin touching. Now imagine, that's like a music festival. Many of us go to music festivals like Electric Daisy
or
Carnival.
Coachella, yeah.
Right. I mean, so people, might wear different clothing at that time, or may not even wear clothing, right? If you're a guy shirtless at a electric music carnival, I could see how you could be skin to skin with a complete stranger. And if there were lesions, then that's kind of how, one of the most easiest ways that monkeypox has spread. So yes, there are women that can be at risk. We know that disease, just like COVID, doesn't see boundaries or nationalities, borders.
But it's a small number.
But the number is very small. We've seen a few children with monkeypox as well. We had one fatality right here in the county. So we know that it's still a very serious issue. That one fatality was someone who was immunocompromised severely. So we know that there are people that are at higher risk. But again, it's a reminder that there's this challenge between public health and truly, providing healthcare to individuals. I describe it, I'm a family physician, so we're constantly grappling with the tensions of the needs of Mrs. Jones right here with me in the exam room, right here, right now, versus the needs of all of society. That 30,000 feet in the air view, the forest for the trees, and we've got to kind of deal with that tension constantly, because what's right for Mrs. Jones ain't always right for society, and vice versa.
And you mentioned the exam room. What other services does Kedren offer? Because you are in an underserved community.
Absolutely. Kedren is a historically Black institution started during the Watts riots to make sure Black and brown individuals had places to go during crisis. And now many of our historically Black institutions are Latino serving predominantly, because many of our communities have shifted demographics from the 60s. And so now we provide services in Spanish. When we talk about culturally and linguistically appropriate care, that's so important. That's something that Kedren does exceptionally well, along with many of us who work in the safety net. Kedren is an acute psychiatric hospital. We deal with patients, adults, and children in mental crisis that need to be hospitalized and placed on medications, or we have to work through their pathologies, figure out a treatment plan before they're safe enough to go back out into society or home. Then we need to make sure that they have mental health services in the outpatient side, so we prevent unnecessary conflicts with law enforcement or unnecessarily being admitted in the emergency room. If we can get to people when they're in crisis in the community, it's everything that I've been saying all along. We just got to get out there ahead of it. Too often it's too late and we're waiting for you in the institutions. We need to come out of that, find you before you need us, and that way we can keep you from getting sick. And in addition to all of that, Kedren provides primary care services to patients as a federally qualified health center.
What illnesses do you see the most often?
Well, one of them, the trifecta, I call it, is diabetes, hypertension, and hypercholesterolemia. And high cholesterol leads to strokes and heart attacks. Those three often go together, and they're very much so lifestyle illnesses. We're not moving as much as we used to. We're eating processed and fast foods, more oils and fats than ever before. So we're not surprised that we're seeing these diseases of luxury that, our predecessors have not had to deal with. And so we really need to figure out a way how to address that. These enormous amounts of calories that we're faced with, and then the lack of movement, all of this is resulting in disease and disproportionately affecting those that are lower socioeconomic status and definitely communities of color. So we need to get better about how we're going to tackle that epidemic. But of course, we see lots of things. STDs are on the rise. Syphilis is on the rise. People had sex and unprotected sex during the pandemic. People started drinking, in large quantities during the pandemic. So there's alcohol use and depression. Suicide went up. So now we're really picking up the pieces. So one of the best things that we can do is we need to schedule those preventive maintenance appointments, go in and kind of, just like you get your car tuned up, it's time to kind of really see, where am I at? Have I screened myself for all those cancers, colon cancer, breast cancer, cervical cancer? Am I teed up? Do I have an STD that's been undiagnosed and I'm spreading it around, or I'm vulnerable because I don't use condoms, etc.? When we talk about family planning, IUDs and other treatments, contraception to prevent unwanted pregnancies, these are all things that now right, we've got a chance to breathe. The COVID numbers are down. Let's catch up on all that missed care that we all need and deserve. So again,
From
live
2
our
years of
longest,
pandemic,
healthiest,
2.5,
best,
yeah.
highest quality life. And that should be, as the physician, that I hope is all of our goal in the healthcare side. Patients too. So when we align those incentives and goals, I feel like that's how we're actually going to get there.
You went to Congress and testified. What did you tell them about health inequities here in Los Angeles?
Absolutely. And I'm leaving for Washington on Friday, and again testifying, this time on things like prior authorizations and how insurance companies failing to pay for treatments actually adversely impacts patients, particularly those that are racial minorities, those that are lower socioeconomic status, most because their insurance plans tend not to cover very essential life-saving medicine. So when I went to the US Senate the first go round during COVID, it was to remind people that on the front lines, we are seeing disparities, and you've got to get those resources to the boots on the ground so that we can continue the life-saving work. The problem now is that COVID's kind of in the background.
Yeah.
It's not as sexy work. So as the resources disappear, these lifelines that have really helped are starting to go away. And I remind folks that when public health works well, it's not sexy. You don't know about it. It's in the background. But when it's broken, there is suffering, there is chaos, there is crisis. So it's a real challenge that we have in public health and medicine to make sure we prioritize what we have and remind them that if we don't do this, then what awaits is that awful wildfire that's going to need crazy firefighting strategies, right? Let's not go back to those days. If we can keep doing the peacekeeping and all the healthy things now, we can prevent some of this suffering later.
How do you think we did here in LA in terms of addressing the pandemic?
Yeah, I think we've come a long way, to be honest. I think the county had made an equity committee, and that helped tremendously. Many of us came together with the County Department of Public Health, the city councilors, the mayor stepped up, the supervisors stepped up. In many ways, we were committed to not making the same mistakes as Chicago, Washington, D.C., many other jurisdictions where the vaccines landed in the exact opposite zip code of where the suffering and the COVID were.
More affluent communities.
We looked at geographic data. We looked at where COVID was. We did some geo mapping, and we said we're going to take them to these zip codes. We're going to take them to these communities, these households. Imagine if one person had COVID in your house, don't you think that makes sense to get that whole house vaccinated? Because they've already demonstrated they're at highest risk. And so by implementing many of these very smart strategies, rather than sitting in a room, doing whiteboard exercises, calling consultants, we were real-time informing the process. And I really believe because of that, many people were saved, many people did not catch COVID, and we did not have the deaths and the suffering that could have been had we not taken equity seriously.
Absolutely. We are just about out of time. Can you briefly tell me, what would you like to see happen?
Yeah, so as we move into this post-pandemic world, and we've heard from the California level, from Governor Newsom, we're going to learn to live with COVID smarter. So I still remind people, be smart, wear masks when it's appropriate and you feel comfortable, even though the policies may be otherwise. Be smart and get tested when you're symptomatic or you think you've been exposed or you're worried you're going to expose people, like visiting folks over the holidays. Make sure you isolate and quarantine when you are sick. Get those booster shots. Get treated when you get COVID. We've got great treatments, including Paxlovid, that help. But as we move to this post-pandemic world, I really want us all to keep coming together, just like we did during COVID, to address all these other social ailments, all of these other epidemics in the background, including mental health, including diabetes and all the chronic conditions. They all need our attention now more than ever. We don't hear about them, we don't talk about them enough, but people suffer and die from those too. And if we can continue to work together, just like we did during COVID, I feel we'll be able to move the dial and ultimately be able to help people live their best life.
And if people want to know more about Kedren, where can they go for information?
Absolutely. If they want to learn more about our COVID-19 programs, you can go to www.kedren.org. And for those wanting to schedule COVID-19 bivalent Omicron booster shots, please visit myturn.ca.gov to schedule your appointment today.
And that is myturn.ca.gov.
Absolutely. Thank you so much for having me, Anita.
All righty. And that is going to do it for this edition of LA Currents. I'm Anita Bennett. Thank you for watching and have a great day. you.